ABC 10 News starts now with breaking news.
We begin tonight with breaking news. Health officials have confirmed today 2 probable cases of monkeypox in San Diego County. The cases must be verified by the CDC, and if they are, it would be the first cases to be found in our county. The county says both cases are unrelated to each other. Both patients are said to be symptomatic but doing well and not hospitalized. Monkeypox is a viral infection spread through bodily fluids and open sores of an infected person. It is also spread through respiratory droplets between people in a close setting and can be transmitted during sex. CDC confirmation of the 2 cases is expected in the coming days. Joining us now to go in depth on the disease is Dr. Seema Shah with County Health, who can walk us through what this means. Dr. Shah, good to have you with us, and we have to start with what's on everyone's mind. How contagious is monkeypox and how is it spread?
Yeah, great question. Monkeypox is actually less transmissible than a lot of other diseases, including COVID. Again, we've identified now 2 probable cases in San Diego that are waiting to be confirmed, but definitely less spread less often and less transmissible. But it's really a contact, like skin contact to contact, a spread of disease, and really that's kind of the intimate contact piece is critical for transmission.
We're also accustomed now to how COVID spreads. So you're talking skin to skin, very different than respiratory and air particles. Just dive into those differences.
Yeah, for sure. And, I think we have learned a lot about how disease spreads during COVID. And, with understanding with COVID, there's a lot of aerosol transmission, even in individuals that have no symptoms. With monkeypox, it's very different. You definitely need to have skin to skin contact for that transmission to occur. Now, there are, larger droplets that can be transmitted, but this has really not been the case in the cases that have been described worldwide. Worldwide, we've had over 1,600 cases, and most of them have been skin to skin transmission or intimate contact transmission.
And we know we have 2 cases here in San Diego believed to be confirmed for monkeypox. But just looking ahead, looking at what you see in other areas, is this a real risk to public health?
Also, another great question. Again, the risk to the public is low. With it being less transmissible than other diseases, that makes it a lower risk to the public. And so, again, for the cases here in San Diego, they're currently described as being probable. They'll be confirmed by the specimens being sent to the CDC for final testing. But as of right now, we have two probable cases, and again, low risk to the public.
Oh, that's good news. Thank you, Dr. Seema Shah, for your time today and joining us to put in these 2 cases into perspective. We appreciate your expertise.
No, thank you for your time.
You can stay on top of the breaking news with the ABC 10 News mobile app. It's free in Apple Store and Google Play.